there's an association between unsolicited patient complaints and adverse impact of work on personal relationships in physicians. So the principal outcome of this paper are PAR scores, which is a measure of unsolicited patient complaints, which have been linked to clinical outcomes. Hi, my name is Joshua Trockle. I'm a data scientist, and I was the first author on a paper that will be coming out in September in Mayo Clinic Proceedings. The name of the paper is Adverse Impact of Work on Physicians' Personal Relationships and Unsolicited Patient Complaints. So the primary outcome of this study was to look at something called PAR scores. PAR scores are actually a grouping of these unsolicited patient complaints to create a metric. And the way it works is these complaints are aggregated over the course of several years. In this study, we looked at PAR scores through 2013, from 2013 through 2016. And more recent patient complaints are given a higher weight, as well as more severe patient complaints. And that's what provides a PAR score, which was linked to each physician. So each physician has, in this study, had an associated PAR score, which was essentially how severe the unsolicited patient complaints were over the course of the last 3 years. The way this study was designed was we looked to find if there was an association between an impact of work on personal relationships in physicians, or essentially whether or not physicians felt like their ability to form new relationships and foster those that they have were impacted by work, and whether that perceived impact of work on their personal relationships had a downstream effect on clinical outcomes, which were measured by PAR scores or unsolicited patient complaints. And secondarily, we looked at other components of physician and professional well-being, such as burnout, professional fulfillment, anxiety, sleep-related impairment, and depression. And we found that physicians who felt like work was negatively impacting their personal relationships, there was an association between that perceived impact and the impact on patient outcomes as measured by PAR scores. And we found that there was also an association between that impact, that perceived impact of work on personal relationships, and things like burnout, professional fulfillment, and sleep-related impairment in all the expected ways. So what this means is that it seems likely that physicians who work in an environment where they're required to sacrifice their personal relationships and their personal life, that this might have negative impacts on patient outcomes. And it might be a negative thing for the hospitals as well, because the physicians themselves are more likely to have burnout and lower professional fulfillment, which can lead to turnover. So next steps in this field of research would be, this was a single site study, so there's no reason that we see why these results wouldn't hold at other sites or be consistent at other sites, or why this wouldn't be consistent among other healthcare workers. We only looked at physicians, but a next step in the literature would be to explore the impact of work on personal relationships on physicians and other healthcare workers at other institutions, and see what other downstream effects there would be. And hopefully later down the line, some interventions can be created to specifically target this impact of work on personal relationships, so that there can be an environment where physicians and other healthcare workers feel like they don't have to sacrifice their personal relationships in order to do their job, and to be able to study that intervention and the downstream effects of that, which seem to be associated with improved patient outcomes. As far as patient outcomes go, any clinical institution that is concerned with patient outcomes should take into account that if they create an environment where physicians feel like work is impacting or interfering with their ability to have personal relationships in a healthy way, then that seems to affect patient outcomes. So it's more for any institution, any medical institution that's concerned with patient outcomes, that they should be aware of that relationship and that association, and make the necessary changes to create an environment where physicians can foster their personal relationships in healthy ways. For further details on this study, on the impact of work on personal relationships and its association with both professional or wellness metrics and patient outcomes, please go to Mayo Clinic Proceedings and read the full article.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.